This presentation is for nursing students to understand some core nursing concepts. Acid-base balance is about keeping the blood pH in a very tight range, between 7.35 and 7.45. If it strays outside this range, enzymes and organs can't work properly. The body has three main defenses. First are buffer systems, which act quickly to neutralize small changes. The most important of these are the bicarbonate buffers and protein buffers. Second is the respiratory system, which adjusts how much carbon dioxide is breathed out. Remember, CO2 is acidic, so breathing faster lowers acidity, and slower breathing raises it. Third is the renal system, which takes longer but is more powerful because the kidneys can actively excrete hydrogen ions and hold on to bicarbonate. When these systems fail, patients develop acidosis or alkalosis, both of which can cause major problems with the heart, brain, and muscles. When we talk about acid-base balance, there are some key points every nurse needs to remember. First is the definition. Blood pH has to stay between 7.35 and 7.45. Even small changes outside that range can affect how enzymes work, how the heart beats, and how the nervous system functions. The body keeps pH in balance using buffer systems, the respiratory system and the renal system. Buffers act as the first line of defense, quickly neutralizing acids and bases. The respiratory system manages carbon dioxide. Since CO2 is acidic when dissolved in blood, breathing faster gets rid of acid, while slower breathing retains it. The renal system is slower, but much more powerful, because the kidneys can excrete hydrogen ions and reabsorb bicarbonate directly. Finally, the clinical significance. If these systems fail or get overwhelmed, the patient develops acidosis or alkalosis. Both conditions can seriously disrupt organ function and can even be life-threatening if not corrected. As nurses, it's critical to recognize early changes in breathing, mental status, or lab values that suggest acid-base imbalance so we can intervene before it becomes dangerous. Proteins are an important but often overlooked part of pH regulation. Albumin, the main protein in plasma, can bind excess hydrogen ions and reduce swings in blood pH. Hemoglobin, inside red blood cells, is a major buffer. When it drops off oxygen in the tissues, it can pick up hydrogen ions instead, keeping the pH steady. This ties directly into CO2 transport. Carbon dioxide is converted to carbonic acid, which splits into bicarbonate and hydrogen ions. Hemoglobin mops up those extra H+ ions. Inside body cells, especially muscle, proteins with amino acids like histidine also act as buffers. These intracellular proteins help slow the drop in pH during high metabolic activity, such as exercise or sepsis, when acids build up quickly. Cellular regulation means controlling how cells grow, divide, and die. Normally, the cell cycle has checkpoints that prevent errors. When this regulation fails, cells can grow uncontrollably, leading to cancer, or fail to replace themselves, leading to tissue problems. Risk factors include aging, genetic predisposition, environmental exposures like smoking, poor nutrition, and immunosuppression. For nurses, this concept is important in prevention, encouraging screenings, educating patients, and watching for early signs of abnormal cell growth. Clotting is how the body stops bleeding after injury. It has 3 stages. Blood vessels constrict, platelets stick together to form a plug, and clotting factors activate to form a stable clot. This system can go wrong in 2 ways: too little clotting, leading to dangerous bleeding, or too much clotting, leading to problems like deep vein thrombosis, pulmonary embolism, or stroke. Nurses assess clotting by reviewing bleeding history,
medication use, especially anticoagulants, and monitoring labs such as PT, PTT, and INR. Cognition refers to the mental processes we use to think, reason, remember, and make decisions. Changes in cognition affect how well a patient can participate in their care. For example, understanding instructions, following a treatment plan, or making safe decisions. Acute issues like infection, medication side effects, or delirium, or chronic ones like dementia or stroke. Nurses assess orientation, person, place, time, memory, short and long term, attention span, and judgment. Early recognition of cognitive changes can point to underlying health issues such as low oxygen, electrolyte imbalances, or infection. Comfort is more than just no pain. It's the state of physical, emotional, and even spiritual well-being. Patients who are comfortable heal faster, sleep better, and cope with illness more effectively. Nurses routinely assess pain using scales, but must also consider anxiety, environmental stressors, and cultural expectations about expressing discomfort. Provide pain management, medication, or non-drug measures. Adjust the environment. Quiet, light, temperature. Give emotional support and respect cultural needs. Comfort is essential for recovery. Patients who are distressed or in pain may refuse food, avoid movement, or struggle with trust and communication. Elimination is the body's way of removing waste. This includes urine from the kidneys, stool from the GI tract, carbon dioxide from the lungs, and sweat from the skin. Problems with elimination can signal underlying conditions. Urinary retention might mean infection or obstruction. Constipation may be due to immobility or medications. And changes in breathing can reflect issues with CO2 elimination. Nurses monitor intake and output, bowel patterns, and respiratory status to keep elimination on track. The adult body is about 60% water, and that water contains electrolytes like sodium, potassium, chloride, calcium, and magnesium. These electrolytes are crucial for nerve impulses, heart rhythms, and muscle contractions. The kidneys and hormones like ADH and aldosterone regulate them. Imbalances can be life-threatening. For example, low potassium can cause arrhythmias, and low sodium can cause seizures. Nurses track intake output, daily weight, and labs, and give replacements or restrictions as ordered. Gas exchange happens in the lungs. Oxygen moves from the air into the blood, and carbon dioxide moves from the blood into the air. It requires both healthy alveoli and a functioning circulatory system. When gas exchange is impaired, patients can develop hypoxemia, low oxygen, or hypercapnia, high CO2. Nurses assess respiratory rate, oxygen saturation, ABGs, and signs like restlessness or cyanosis. Supporting gas exchange may mean positioning, oxygen therapy, or encouraging deep breathing. Glucose is the body's main fuel, and regulation keeps blood sugar within the normal range of 70 to 110 milligrams per deciliter fasting. Insulin lowers blood sugar by moving glucose into cells, while hormones like glucagon and cortisol raise it. Disruption leads to conditions like diabetes. Hypoglycemia causes immediate danger with confusion and seizures, while hyperglycemia damages blood vessels over time. Nurses check glucose levels, recognize hypo and hyperglycemia quickly, and educate patients on nutrition and medications. Let's look at two core concepts: immunity and mobility. Immunity is the body's defense system against infections and disease. It has two parts: innate immunity, which is our built-in protection like skin, inflammation, and white blood cells, and adaptive immunity, which learns over time and builds memory, like what happens after vaccines or infections. Immunity can be weakened by age, chronic illness, or medications such as chemotherapy and steroids. As nurses, we focus on assessing a patient's history of infections, vaccination status, and current signs of infection. We also keep an eye on white blood cell counts and risk factors that might compromise immune function. Mobility is a person's ability to move purposefully and independently. It's essential not just for walking, but for nearly every system in the body. Circulation, lung expansion, digestion, and skin integrity all depend on movement. When mobility is limited, the risk of complications like pneumonia, blood clots, constipation, and pressure injuries goes up. Our assessments include checking range of motion, muscle strength, balance and coordination, and whether patients need assistive devices. We also evaluate fall risk, since safety is a huge concern. Together, these two concepts highlight how body defenses and movement affect overall health. For example, an immobile patient is more likely to develop infections, and an immunocompromised patient may struggle to recover from even minor injuries that limit mobility. Nurses play a key role in spotting these risks early and intervening to keep patients safe. Sexuality is an important part of overall well-being, including physical, emotional, social, and cultural aspects. Illness, medications, or treatments can affect sexual health and body image. Nurses should approach sexuality with respect and without judgment, ensuring privacy and cultural sensitivity. Providing education, counseling, or referrals can help patients maintain this aspect of their quality of life. Tissue integrity means the skin and underlying tissues are structurally sound. Healthy skin is the body's first defense against infection. Problems arise from immobility, poor nutrition, incontinence, or vascular disease. Nurses assess skin color, temperature, and texture, monitor wounds, and implement measures like repositioning, moisture management, and good nutrition to prevent breakdown and support healing. When we think about health concepts, it's important to remember that patients rarely have just one issue. There are many risk factors that influence how these concepts play out. On the individual level, risk factors include age. Both pediatrics and geriatrics are especially vulnerable, as well as genetic predisposition, chronic illness, and lifestyle choices such as diet, smoking, or physical activity. On the environmental side, social determinants of health play a huge role. Limited access to healthcare, unsafe work environments, exposure to pathogens, and cultural influences can all affect outcomes. For nurses, the response is always the same. Start with a comprehensive assessment. Get the full picture of the patient, not just one lab value or complaint. From there, provide patient education tailored to their needs and literacy level. Prevention is key, so we emphasize vaccines, screenings, and healthy behaviors. Nursing care is never done in isolation. It requires collaborative planning with the healthcare team, the patient, and often the family. And finally, we always practice continuous monitoring and evaluation because patient conditions and risk factors change over time. So the takeaway here is, whether it's acid-base balance, immunity, or mobility, our role as nurses is to identify risk factors early and put interventions in place that promote safety, prevent complications, and improve outcomes.